Welcome back to another edition of Cancer with Dr. Denise Ejo, the CEO of Colorectal Cancer Foundation, a cancer awareness program in partnership with Plus TV Africa. Together we fight, together we win. Thank you all for championing the cause of cancer patients and getting our voices heard this 2025. I welcome you to another edition, and the focus will be on trust and treatment, strengthening the patient experience. Today, we will discuss trust and treatment, strengthening the patient experience, colon cancer care. As I said, I am Dr. Denise Ejo, CEO of Colorectal Cancer Foundation, and we will focus on a critical health issue that affects thousands of Nigerians. So firstly, let me welcome my guest. Adebiyi, how are you? Good afternoon.
It's a pleasure to be here, Doctor.
Thank you very much for being with us, and thank you for your time. I know it's busy, and I'm going to ask you, how is treatment going?
Well, treatment, we're pushing it slowly. We're pushing it with the grace of God. It has not been an easy experience. It has been a very tough, rough journey, but we thank God for His mercies and for keeping us alive every single day.
Thank you. Thank you for joining me. I really feel honored whenever I get champions on the program. So just sit back as I introduce. For many, cancer diagnosis can be overwhelming, filled with fear, uncertainty, and countless questions. But beyond the diagnosis, the treatment journey is just as important. How do cancer patients cope? Do they trust the healthcare system? And what can be done to ensure that every Nigerian facing colon cancer receives the care, support, and dignity they deserve? Those are the questions we want to raise today. So tonight, we are honored to have our very special guest, Dayo. I'm going to call you Dayo for the whole thing, or do you want to be called Adedayo?
Adedayo is fine.
Adedayo is fine. So we're going to have my special guest, Adedayo, who is currently undergoing treatment for colon cancer. He will be sharing his journey, the challenges and triumphs, and what it truly means to navigate cancer in Nigeria. So let's join us, relax, and let's start our conversation on how we move forward in changing the narrative. This topic is trust and treatment, strengthening the patient experience, colon cancer care. Let me introduce my guest. So Dayo, I'm going to introduce you. And I did a better job than you introduced yourself. Dayo is a young man and a cancer champion and advocate. He's passionate about advancing scientific research and drug development to improve patient outcomes. He's well educated, deeply committed to raising awareness and supporting others on their cancer journey. He uses his voice to inspire change. Beyond his advocacy, he enjoys or finds joy in artistic expressions and the vibrant world of football. His compassionate spirit and dedication make him a powerful voice and force in the fight against cancer. So let's begin this conversation. Please follow us, share, and subscribe to Colorectal Cancer Foundation and Plus TV Africa. Sit back and let's relax. Are you ready for me?
Yes.
Awesome. My first question. Can you take us back to the moment you first received your cancer diagnosis? What was going through your mind?
When I got my cancer diagnosis, we weren't too sure about the kind of cancer particularly that was on with me. The first diagnosis I got was sort of a blood cancer kind of situation where I was diagnosed with they started with plasmacytoma, then they moved on to multiple myeloma. Before we had all the scans and all the hospital doctors coming in and saying, no, this is not what it is, this is not what it is. And then we had all the biopsies taken from my skin to my blood to the tissues in my tummy. And then we now discovered that, all of these things that we've been talking about is not even the plasmacytoma, is not the multiple myeloma, but it's a colon cancer. However, when I got diagnosed, when I realized that this was the situation, I practically lost my mind. I was scared. That was the first thing. I felt this was just going to be the end, and I didn't know what to do. All I just kept doing was I just sat down there and I just kept crying. I mean, I don't really cry so easily, but the tears just kept pouring and pouring endlessly. And I had people coming saying, "Oh, just stop! It's not yet." I mean, people just trying to just sympathize with me. And I'm not really good with empathy and sympathy, so it wasn't working for me. And then I just kept crying and asking God, why? What did I do wrong? How did I get it wrong? Where did it happen? It was just so overwhelmed. It brought me down emotionally in a way I have never felt before, because I mean, I just blanked out from the entire world. It was like my world went dark all of a sudden. So it was really, really scary. I mean, letting me know that and then just leaving me alone to absorb all of that by myself for a very long time. So that was how that was what went on my mind for that long. And at that point in time, all I could do was, God, 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 where are you? Where are you? What is going on? That was all that was in my mind.
That's very interesting. It's very interesting you come from that perspective, because every time I try to explain to people that we blank out, I don't think a lot of people understand that statement when I say when a cancer patient gets a diagnosis, they blank out. We don't hear anything people are saying. We don't understand what you're talking about.
They don't understand.
You're just trying to sit down there and get an understanding of, okay, let's see how it goes. What did we do wrong? And those are very common and valid questions that we go through, unfortunately. So let's look at your treatment now, because you made a statement which was quite interesting about your roundabout journey to getting here, which is quite interesting. So let's look at that. So what was your treatment journey, or what has your treatment journey been like so far? You know, I would say to you, I live with cancer and I take chemo every week, okay? Every day, every week, every 3 weeks. Okay? Yours is different from mine, but you take chemo. Okay, go on, explain yours, because yours is different from mine. I don't understand yours.
Yeah. So my journey started in 2018, 2019. About when we were still trying to know what was going on. When around the lockdown, we were able to pinpoint, okay, there's a colon situation. And before my treatment, I was told that my cancer was sort of encapsulated, that it was still something that could be controlled, or something that that surgical intervention could be of help. But along the line, when I did my MRI and all of that, my surgeon, practically rejected me and said no, he wouldn't be able to do a surgery where he would cut off the colon from me, because mine was already badly affected because of all the time I've spent over the years not doing anything. So that really made me feel so sad. And then I decided, okay, if I cannot do the surgery, what next? He said either I have a bag outside my stomach, or I go do radiotherapy or chemo, which eventually made me to go look for an oncologist who would actually take up my case. On going to my oncologist, they decided to put me on chemo instead of radio. I suggested for radio, but they said chemo was better because radio would do a lot of damage, because my lymph nodes were already badly affected. When I mean my lymph nodes from my belly down to my feet were all badly affected, and I had swellings from my belly down to my feet, really bad swellings. So I ended up doing chemo. Now my chemo, the chemo they placed me on was a 3-weekly experience. It was 3 weeks. Every 3 weeks was like a torture for me, because I never experienced those kind of things. I've never been shown. I've never seen that kind of life before, and I got the opportunity to meet other people who were also taking their treatments, because I couldn't afford a single ward. I had to be in a general ward. So I saw all sorts of people with different kinds of cancer. It was scary, but it was encouraging to know that, okay, dude, you're not alone in this race. You're not alone here. you should fight for yourself. You should be able to, stand in at this moment, absorb all this pain. Because I mean, there are people who are younger than I, older than I, older than I am, that are taking this treatment and are still and are alive. I was I felt so overwhelmed and scared. And when I started my treatment, it was very funny because I had to go through a series of putting my date, aligning my date, then my day 1, my day 3, my day 5, my day 6, all the days I'm supposed to be in the hospital, making sure that I follow up that pattern. And the journey has, however, been so, it has been an experience because, when you take a lot of treatments and you don't have to always go tell the doctor, this is what happened to me, this is what's going on with me. But in the case of my treatment, I had to always go back because I was always having this side effect, that side effect, complaining about this, complaining about that. And doctor would just tell me, Adibi, calm down. You would, all these things would be outgrown. You would go through, these are things, normal things you would go through. However, they look like normal things, but they are scary because imagine when you have all your white teeth turning black. You have all your palms, your nails, your feet, everything all black. All black. That's around, I think the second or the third time I took the chemo. The first time it was just my throat, itchy throat, my throat was getting dry, I couldn't speak, I was a little bit I was a bit numb on my feet. A lot of different things were just happening all at once, and it was so scary because I didn't know where to run to or what to do. But when I discover, okay, maybe I'm having this cough or that problem, I will go to the doctor, can I buy cough medicine? Can I add this to my clinic? And they're like, oh, take it easy. Don't take too many things. It will all wear off. It will all wear off. It was scary because everything all happens is happening all at once. And the most painful one that happens is my hair. I used to have plenty of hair. I used to love life. I used to want to have different shapes, different styles done. But look at me right now. Nothing is there. So it's been an experience that, God, I just give God the glory that my body has been able to accept the treatment, and I use everything within my energy to make sure that I remain happy. I keep positive. I make sure my BP my blood pressure is at the right level. I make sure my sugar is at the right level. I make sure everything is just perfect. I try to abstain from everything, social events. I abstain from a lot of different kinds of food, drinking. Just make sure that I'm always at the point of a good, at the point when I'm about to get my treatment, I'm just right. So the treatment has been just God's favor and God's blessing, keeping me this far. It has not been easy, but keeping me this far.
Thank you. I started to smile because you reminded me of my very first cancer experience. When I saw my nails were black. And even at a point, my nail on my foot came off. Off because of the chemo, and then the bald, and then and then no eyebrows.
The
eyebrows is very terrible. No eyebrows.
Yes.
Anyway, let's continue with it. And then we're going to the break. I'm asking you got 3 minutes to answer this, and then we'll go on the break. So now, many people worry about all these side effects on that, and we know that. So from your experience, can you give them, because people are watching who are going to have this, and they will not want to do it because of what we are saying, but can you give them 3 suggestions of what they can do to at least manage it, either physically, emotionally, spiritually? We all agree. I think there's no cancer patient that will tell you that this is not God. If it's not God, you can't do it. So just three options, and let's take a break quickly.
So managing the side effects, the first thing is never lose your mind to any side effect that comes your way. Just know that whatever happens to you within the period of treatment is because of the treatment you're going through. whatever side effects you feel. So do not lose your mind. Just try to make sure you keep calm. Understand your body system. Understand and observe your body system, and try to just maintain a level of calmness. That's the first thing. Do not lose your mind. Do not lose control of your mind. Do not get scared that something else is going to happen. It's fine. The first time might be very tricky, but subsequently, do not lose your mind. Try to keep calm. Try to put God first in everything, and try to maintain a status quo where you don't have so many people coming around you at that point in time. But you have to be, I would say isolated. I won't use the word isolated, but you have to keep indoors for that time being, so you can actually manage whatever is going on with you. And peradventure, you cannot manage some certain things. You can ask your doctor if you can buy some medicines to stop some certain things that are actually. That's if your doctor agrees that you take those medications, because it's very important you're always in touch with your doctor to let him know, okay, doctor, this is what's going on with me. Can I take this? Can I do this? Can I do this? That is one thing. You shouldn't just go ahead and take anything because you're itching, you go take something. Because you don't want anything that will complicate the treatment you're going through. So the first thing I always try to tell people is keep calm. Build up your mind. Have a sort of mind, how will I put it? A mind, this thing, that you can always control whatever is going on with you, and knowing that fully well that God will take you through it all. Aside that,
no, let's take a break now. We're going to come back in a few minutes.
All right, doctor.
I want to say a very big thank you, because you are actually hitting the nail on the head. So viewers, Adebayo is going to. No, he said Adebi. You see, you
Adebayo.
You're confusing me because it's Adebi. You refer to yourself as Adebi, but
yes.
Yeah, you're the one causing the confusion. Anyway,
I'm sorry, doctor.
Adebi. Come back to this conversation in a few minutes, and then complete the second half of the program. So stay tuned and take this conversation with Adebi. Thank you. Yeah. Welcome back, and thank you all for staying with us. We continue the conversation with Adebi as he continues to explain to us about the trust and treatment as we go through colon cancer. So, thank you for staying with us. Together we fight, together we win. Next question. Okay, let's look at our support and coping mechanisms. Cancer treatment, as we will agree, is not just a physical battle. It has the emotional battles that come with it. Where do you find your strength? And I am very glad, because I feel very convicted today, because every time I say Jesus is at the center of it all, for me, you just help me to say, yes, I am not getting it wrong, because that's the only thing that I believe we have. So outside of that, where else do you find your strength and support from? And I'm going to give you examples. You've got family, you've got friends, you've got your faith, you've got your support groups. Where? Because people across Nigeria need to find these same tools in different spaces, in my opinion.
So, for my support and care, firstly, I want to say God. God, number one, has been my biggest, my biggest support system. However, from my friends, my family, they have all been so amazing. When I mean my family, not all of them, but the few that I can tell. I couldn't tell a lot of people, but I just told a few. And the few I told have been very supportive. Very, very supportive. I mean, when it comes to the financial aspect this time, that is why I mean the spirit of support. Aside from the financial, the care, the encouragement, the don't give up calls, the let's pray a little bit more calls, the less have you eaten calls, what are you doing right now, hope you're not thinking too much kind of calls, and then from my friends, not only from the friends that I've known, way back from school, my classmates from school, my friends in the church, my pastor. God bless you, sir. You know, they have been so encouraging. They have been my drive, my support system, and also my colleagues at work. Because I mean, it was scary for all of them knowing. Some of them withdrew, some of them like, oh, this guy is going to die soon. And then some of them still rose up to the occasion and said, no, this guy must live, he must survive. And they have been very encouraging, very supportive. Some not financially, some just with the words of prayer, some sending foodstuffs, making sure that I do not go hungry, knowing fully well that my whole system, I'm paying so much for the treatment. I mean, the support has been very encouraging, and most especially even from some Muslim association group and football club associations, they have been so, man, I'm even overwhelmed. I'm surprised. I even feel like, what did I do to deserve so much love from these people? So, and majorly because I've been able to voice out and tell people and tell a lot of people that this is what's going on with me in my life. There are some people that don't know how to say these things. There are some people that don't know how to say what is going on because of the stigma or because of the idea or the fear they're going to die. But do not be scared. Voice out as much as you can. Say these things out. This is what is going on with me. And then you see that angels will come your way in whatever dimensions. Yeah.
Wow, I like the way you've done it. And okay, so I'm going to ask you the next question. And then your last question after this one is going to be your 2 facts. So, colon cancer is not often, okay, so let's put it like, it's not often talked about in Nigeria.
Yes.
I think it's number 3 now. I think it's number 3 or number 2.
Okay.
What would you say to someone who might be experiencing symptoms?
This is
Go.
Okay, now this is a very important thing for whoever is going through any bowel irritation, any stomach upset, any movement in the stomach. It is very important that these symptoms, however, if you notice it, please run to your doctor. Run for a scan. Run for a checkup. In my own case, I was doing, I would just take some medicine, I would get better soon. I didn't run to a doctor. I didn't run anywhere. I just felt it was a stomach pain, or maybe I ate something, food poisoning or something. Whenever you feel a bowel irritation, whenever you feel anything wrong with your stomach, that is how you know that there is something wrong in your large intestine. It is a very tricky thing. You might not know immediately, but you need to understand that those are the symptoms you need to pay attention to. We Nigerians do not pay attention to what is going on with our body systems. We do not take note of all these small things. Even the minute headache you have happening in your head, please run to the hospital. It might be something very important that you need to check up. Do not say you're strong enough to withstand whatever pain. I might be saying I have a very strong pain threshold, which I do, but do not stay till the time it becomes worse. If you notice anything, run to a doctor. That is the most important thing. Go for a checkup. These are very important keynotes that you need to know about colon cancer situation. When you go to the toilet, you stool, and your stool turns from solid to liquid and does not stop over a period of 2, 3, 4, 5 months. It is important to run to your doctor. Those are the symptoms you need to take note of. It is something that is very important. Please, whoever is listening to me, wherever you are, listen to your belly. Your belly won't give you problems if it doesn't have a problem in it. So if there's a problem there, go after it. Colon cancer, it's a very difficult thing. We do not pay attention to it in Nigeria. I only plea that anybody going through such a situation should be strong enough to stand tall and stand firm and hope that the best will happen to them, no matter what.
I like the way you've said it, because I always keep saying this thing. Any sickness that is persistent,
yes,
wait, because cancer is everyday sickness. Headache, mine is headache because it's stomach ache, and yet we have gone far in this journey. So please, for those listening, I'm not the one talking; it's somebody else, so it's not my personal. You got to give me one thing as we round up that you want the government to do for us. One thing in one sentence.
One thing. I want the government to help every cancer patient every single cancer patient in getting their drugs. This is something that has been so painful to me. I spend so much every 2 weeks. Every 2 weeks, if the government can help us to just, I'm so sorry. If the government can just help us to just solve our medication pattern, because we fight every day. We have one of our drugs that can cause, they can tell you 600 and something thousand. I spend almost 1.5, 1.7 every 2 weeks. Every 2 weeks. I don't have that kind of financial capability, but I have people who try their best, home and abroad, every week. Some people are even tired of me coming to meet them for the same thing every week. So I know that the government should help people like us to reduce the cost of our medication and just fund whatever cancer foundation they can help assist in improving or getting our drug combinations from, because honestly speaking, it's not easy. Running up and down every week, even with our conditions and all that. So it is, I'm so sorry.
No, Adebi, thank you. You're as human as any cancer patient, and I think people are very emotional about this particular sentence you're making, because I always say people, the most expensive begging community in the world are cancer patients. We beg for food, we beg for medicine, we beg for house rent, we beg for treatment, we beg for everything, we beg to look after our children. Even for food. Yeah, right. That's the point. And even food. And people don't realize that once you get a cancer diagnosis, you can't do a lot of things. And I'm going to end this program by saying to everybody, you can hear I did that. If you want to reach out, please reach out and let's see those that are willing to help him, because he's going to stop his treatment, as he says, in April, because he can't continue. We can't allow that. Somebody who's telling us what to do. So I'm appealing to the government, please help us to help him. Adedayo.
Thank you so much, Doctor.
Thank you very much, and let's see where we go. Thank you for joining me today. Thank you for everything. Thank you for sharing your vulnerability on this platform today.
Thank you so much.
Thank you for reaching out from the bottom of your heart, and hopefully anybody going through this particular illness, you do know that you're not alone. All of us have cancer. We all go this crying. We all go through this. It hits the core of our bones. And that in mind, thank you, my darling brother. Thank you.
Thank you so much, Doctor.
Thank you all for joining me today. Let's remain united against cancer. We are unique by our fights. So together we fight, together we will win. You can watch us and follow us on any of our social media platforms. Common Cancer Foundation. We have a YouTube channel. We have the WhatsApp groups. We have LinkedIn, everything. Just go on and look for either myself or the YouTube channel. You will find us. And subscribe, notify, share it, because that's the only way we can actually get our voices heard. Together we fight. Together we're going to win this. And we're going to make a difference that helps all of us to get where we want to go. I want to thank you all for joining me this week. I want to thank my younger brother here, Adidara, for really bringing out your heart to the general public. And to all of you that have listened, if you want to help, please reach out and let's see how we can get to complete his treatment, because it's not very funny when you can't complete your treatment. And we support the campaign. I'll see you all again next week when we continue this conversation on colorectal cancer. Good night.